Metoprolol tablets, it has antianginal, hypotensive, and antiarrhythmic action. The hypotensive effect develops quickly. Systolic blood pressure decreases after 50 minutes, maximum after 2 hours, and lasts for 6 hours. Diastolic blood pressure changes more slowly. A stable decrease is observed after several weeks of regular intake. Indications: arterial hypertension, tachycardia, ischemic heart disease, myocardial infarction, prevention of angina attacks, supraventricular tachycardia, ventricular extrasystole. How to use: tablets are taken orally with a small amount of liquid, without chewing, with or immediately after meals. Tablets can be divided. The course of treatment is not limited in time and depends on the characteristics of the course of the disease. If it is necessary to cancel treatment, the dose is reduced gradually, at least within 10 days, under the supervision of a physician. Arterial hypertension. The initial daily dose is 50 to 100 mg in 1 to 2 doses, morning and evening. With insufficient therapeutic effect, the daily dose can be gradually increased to 100 to 200 mg. The maximum daily dose is 200 mg. Angina pectoris, arrhythmias. Prevention of migraine attacks, 100 to 200 mg per day in 2 divided doses, morning and evening. Secondary prevention of myocardial infarction, 200 mg per day in 2 doses, morning and evening. Functional disorders of cardiac activity accompanied by tachycardia, 100 mg per day in 2 divided doses, morning and evening. When a therapeutic effect is achieved, the dose is reduced under the supervision of a physician. Elderly patients are recommended to start treatment with 50 mg per day. Contraindications: hypersensitivity to metoprolol or other components of the drug, heart failure in the stage of decompensation, cardiogenic shock, bradycardia, arterial hypertension, metabolic acidosis, late-stage and severe disorders of peripheral circulation, lactation period, age up to 18 years. Special instructions: if necessary for patients with diabetes mellitus, the dose of insulin of hypoglycemic agent administered orally shall be selected individually. Cancellation of the drug is carried out gradually, reducing the dose within 10 days. Special monitoring of the condition of patients with depressive disorders taking metoprolol should be carried out. In cases of development of depression, it is recommended to stop therapy. During the period of treatment, it is necessary to refrain from driving vehicles. Side effects: central nervous system, dizziness, insomnia, asthenia, respiratory system, shortness of breath, rarely bronchospasm, cardiovascular system, bradycardia, atrioventricular block, cold extremities, blood system, neutropenia, thrombocytopenia, sense organ, dry eye syndrome, transient visual disturbances, gastrointestinal tract, dyspepsia, diarrhea or constipation, reproductive system, decrease in potency, skin, hyperhidrosis, allergic reactions.